Please be advised, all music tracks used in this production are sole property of Kelsunn Communications and are original compositions. Thank you.
Hey, it's Scary Jones, executive producer of Elvis Duran and the Morning Show on Z100. I want to talk to you all about my friend and fellow Brooklyn College alumnus, Silas, your e-journalist, social work advocate. Silas hosts and produces the award-winning Kelsunn-on-the-Air social work podcast. My friend and fellow BCR alum is now known nationally and internationally as Silas, your e-journalist, social work advocate. His podcast, it's also listed as one of the top social work podcasts you must follow, the award-winning Kelsunn-on-the-Air social work podcast.
Hello and welcome to all our listeners and viewers. This is Silas, your e-journalism social work advocate, producer and host of the award-winning Kelsunn-on-the-Air social work podcast, available wherever you get your podcast. Our podcast is rated internationally as one of the 40 best social work podcasts you must follow. This podcast promotes, celebrates, uplifts, and highlights the social work profession. Our aim is to educate the general public about the powerful impact social workers have on the lives of those they serve. The podcast will also amplify the vital contributions professional social workers make in every aspect of our society every day.
Hello, everyone, and welcome. This is Silas, your e-journalism social work advocate, host of the award-winning Kelsunn-on-the-Air social work podcast. And I'm really excited today to bring to you a topic that's near and dear to many in society, both here in this country and globally, and that is the topic of aging. Now, we all know that here in this country that the population is getting older and grayer, and the number of people who are stepping into senior citizenhood of baby boomers is increasing. There are a lot of statistics out there that say that the elder population is growing at a very fast clip, which means that there's a lot of issues and topics that need to be addressed as far as their care, their well-being, their health, and also the other side of that, which my two experts are going to discuss, is the caregiver. Okay, how do they address those issues? Because you've got families who have sons and daughters working, raising their own children, and now they're also being tasked, lovingly, I should say, with taking care of their elderly parents who are now aging and can't do the things that they used to do. So we're going to have a conversation about all the different aspects, and I'm just going to say to my listening and viewing audience, this is going to be the start of something much more deeper and in-depth. So I can tell you right now, stay tuned for more on this topic. But for right now, I'd like to introduce my two esteemed guests and tell you a little bit about them. And then we're going to get into this conversation about the topic of aging and why and how it matters. First, I'd like to introduce to some and present to others Ms. Dawn Shedrick. She's an LCSW, a licensed clinical social worker. She's a consultant, educator, and trainer. She founded Gentex Training and Consulting as a professional development firm for health and human service professionals. She's been her mother's primary caregiver since 1996. Welcome to the show, Dawn.
Thank you.
And then we have Dr. Tara Anglim. She's an LCSW, and she also has her accreditation as an ACHP. I'll let her explain a little bit more about that. She has spent her 30-year career working with individuals and families in a variety of systems and clinical settings. She is proud to work within healthcare for the last 12 years, currently serving as the Associate Executive Director of Culture and Experience for Peconic Bay Medical Center, Northwell Health. She began there in 2013, where she served as the Associate Director of Palliative Medicine. And so at this point, we're going to also say, welcome to the show, Dr. Anglim, and I'm so excited to have both of you here.
Thank you so much. I'm so excited to be here with you and Dawn.
Thank you. Thank you so much. So the topic that we're talking about now, every day you turn on the TV, you go online, you hear the radio, you look in the newspaper, you see something about elder care, palliative care, hospice. And so I'm going to give you both an opportunity to educate listeners about some of the nuances of all of these topics so that they can have more information. And as you share your information, you can also provide any links to information or phone numbers that might be helpful to those who might be in this position for the first time. So I'm going to start with you, Dawn, and I'm going to ask you to tell our listeners a little bit about the diverse needs of our diverse aging population.
Absolutely. Thank you. And thank you for the invitation. Where do you begin when you talk about the needs of our aging population? And I have to say, as someone who turned the big 50 this year, like it's just even more like a part of just my own, processing. Like, what does it mean to, to spend more time on this earth, and what am I going to need, as I continue to age? And I think it's important for us in these conversations to realize that although there are a lot of similarities and needs in terms of, our aging, community and our aging elders, but it's also important for those of us who are supporting those who are aging, providing care in many different ways, that it's important for us to understand the diverse needs based on people's lived experiences, social identities, health issues, the impact of oppression like on them based on those social identities. And so it's one thing to talk about how do we, provide support to our aging population, but I think what's most important is for us, like you said, to like get into the nuance so that we can ensure that whatever it is that we are doing to support our aging, loved ones, our aging community, that what we are doing and what we are offering like actually like will meet their needs.
Thank you for that. Thank you for that. And with that said, I'm going to then ask you, Tara, to talk a little bit to our viewers and listeners about caregiving crisis in the United States as we speak now.
Thanks, Silas. So, you mentioned when you introduced me that I was started in healthcare and palliative medicine. So I would just say that the caregiving crisis became very apparent to me in my role in palliative medicine because I was working with individuals, who were diagnosed with serious advancing illnesses. And every single person that was living with a serious disease had a family caregiver, whether that was family that was a biological family member, or if it was family of choice, like someone that was their chosen person. It's interesting to work in healthcare and to understand all the advancements we've made in healthcare for people to live longer, right? I can remember, I'm too in my 50s, Dawn, so I can remember as a child, you didn't really talk a lot or understand as a child when someone had something like serious heart disease or they had aggressive or metastatic cancer. There's so many advancements now. People can live longer, but they don't live longer without needing care. And the healthcare system in America has really developed and been built on the idea that hospitals and care centers across the continuum provide acute types of care, but the daily ongoing care for people as they age and are living with chronic or serious illness really falls on the hands, the hearts, the minds, and the wallets of the people who love them most. And I consider those people family caregivers, whether they're biological or just choice. And so the caregiving crisis currently is that we have 53 million people in the United States who are caregiving, and we're approaching a real dramatic shift in our country that we're starting to feel now as our baby boomer generation is beginning to age. And so that creates a second problem, which is who's going to care for people as they're aging. As we know, the families in America have changed a lot. People don't all live in the same places that they grew up, like maybe they did 30 or 40 years ago. And family sizes have gotten smaller. So there's less biological family members often to care than maybe 40, 30 years ago, the size of the family. And also relationships. People are often, the divorce rate in America is high, so people may not have a spouse or have a significant other that they're living with to help care for them. So as we think about this aging shift in our country, we're seeing the beginning of what's called a caregiver crisis. And you mentioned a little bit, Silas, about that sandwich generation. That's becoming much more of the norm in our society. And I believe we're going to continue to see this crisis over the next few decades as our baby boomers age.
Thank you. And you just mentioned a topic, and maybe some of our viewers and listeners are not really familiar with it. So can you explain a little bit about the term palliative?
Sure. And I love that you ask, because I make an assumption sometimes, but I forget. Most people don't know what palliative care is. So you're right, Silas. That's a good question. So palliative care it's a medical discipline that's focused with an interdisciplinary team with physicians, social workers, chaplaincy, and nurses that center around caring for people with serious or advancing illness at the beginning of diagnosis all the way through till the end. So many people know what hospice is. That's care at the end of your life. But palliative is actually care at the beginning of a serious diagnosis for a serious progressive or advancing illness to help treat symptoms and really focus on quality of life. So being a social worker, and I know Dawn and I have had many conversations around this, it really connects very much palliative medicine to being a social worker because it's rooted in the idea of person-centered care. And that's just something as a social worker that I know is important to all of us, is understanding that it can't be the same thing for everyone. You have to really listen and find what matters most to somebody to be able to deliver on what's quality of life for them.
Mm-hmm. Thank you so much. And Dawn, talk a little bit about the diversity of caregivers who are caring for our aging population, because that brings to mind a lot of, well, who are these caregivers and what's their profiles? Talk to listeners and viewers about that.
Absolutely. I mean, so if we talk about an age cohort, right? The bulk of family caregivers in the United States that we know of are Gen X, right? Like my generation, right? A lot of, us are also in that sandwich generation, right? I don't have any children. I don't have any human children. I have canine children. So, so I personally can't relate, but most, if not all of my peers who are caregivers are like in the sandwich generation, right? So with that, we also are spending more time on the planet. So we are, like I said about myself, we also are like advancing in age. And, I'll even say like I am navigating menopause and changes in, my creaky knees, and, I'm just more present to like how my body is changing, and just how my health, is changing as I age. But at the same time, I'm, taking care of my mom. Understanding the diversity of just social, even just sexual identity. Happy Pride Month, right? So there's an LGBTQ caregiver center that's, really like doing a lot of programming this month. So you have folks who identify as LGBTQ, queer, ... with all the letters. And, like one of my closest friends is a transgender male, so born female, but has transitioned and lives as a male. And he was caring for his mom who transitioned a few years ago, but he was taking care of her. And there was that complex relationship because she really struggled to accept his identity. But as she was nearing the end of her life and she had like significant, chronic and eventually terminal illnesses, he showed up for his mom. He was supporting his mother. He, like was working full time and taking care of his mother around the clock, was also financially supporting his mother while caring for her. But at the same time, had to navigate, her struggle with his trans identity. And so for like many people, who have that experience, it's like whether they want to or whether they, do it out of love or not, they do it and they're providing care, but they also have to, navigate any transphobia, homophobia, biphobia, right? The same thing goes, for folks of different racial and ethnic identities, right? So they're trying to, and I can, relate to this, contending with a system, that a healthcare system in particular that many of us know, especially professionals, academics, researchers, we know the data, We know about health disparities. We know how that impacts, folks' health. And many of the people that we're taking care of, you know, aren't directly impacted by that. There's also data that tells us that the Latina community and the Black African American community of caregivers also bear like a disproportionate financial burden when it comes to caregiving, whether it's meeting expenses that are not met by insurance, whether it's the cost of having to take off from work, having to engage, in other ways with the system. And so that's why it's important, especially again, for those of us who are providing care, for those of us who are, creating solutions in our research and scholarship to understand that we can't just offer, blanket interventions. If we really want to have an impact on this caregiver crisis, and I could not agree with that designation more, then we have to be able to meet the needs of the people who are providing care. And that's an incredibly diverse community.
Thank you. And Tara, I want to turn to you and ask you to elaborate a little bit on the supporting the needs of family caregivers across the healthcare continuum. Caregiver centers as a model. So what is that looking like? And explain that to our audience, please.
So first of all, I love everything that Dawn just said. I can't not add to what she said. I just think in terms of the most disenfranchised populations are often the ones that are taking the largest hit in terms of impact to their income and jobs they have to take, in terms of the resources they utilize. They're often a group that resources are not actually making it to them in the early, when they take on the caregiver role till much later. So I love everything Dawn said. I think it's not talked about enough, because the way we engage the solutions is by really talking to the family caregivers themselves. And I know Dawn's been a staunch advocate, and I'm grateful for that, because you only come to stuff with your own lens. You have to really listen there's so much diversity in terms of populations of caregivers, and also diversity in the situations of caregiving. They're so different. So I think that poses a lot of challenges when you ask about programming. I think that's a piece why historically programs have been originally very disease specific connected programs. And what we're starting to see, and I'm so excited to see, is that we're seeing more caregiver focused programs that are not specific to disease, but are starting to really understand that being a family caregiver is a distinctly different role than being a family member. I know lots of people who are adult children. The ones that have never been a family caregiver have no idea, even when I tell them the kind of work I do, what it means to be a caregiver. And you talk to someone for about 30 seconds who's been a family caregiver, and they immediately say, I wish I would have had that kind of support when I was caregiving. So the programs, what we're seeing and what there's a lot of funding and research about, are more caregiver directed programs that are moving a little bit away from the disease specific, like focus around what the patient is living with, because populations are aging and people over 65 are living with one or more chronic advancing illnesses. So, as diverse as population is a caregiver, so is the complexity of caregiving, because you can have multiple things going on for a person you're caring for. So the caregiver programs that I am most excited about, and I'm a little biased, as Dawn already knows, is we have caregiver centers that started as a model in New York. They started, the first caregiver center in the country in a hospital was opened in 2007 by Marian Hamilton. It's called the Ken Hamilton Caregiver Center, and it opened in Mount Cisco up in Northern Westchester at Northern Westchester Hospital. And she was actually the family caregiver for her husband, who had metastatic advancing lung cancer. And she was caring for their children while caring for him. And her experience was that he received so much care throughout the continuum, but she received no care as his caregiver. And so when her husband, passed away, she felt so changed by that experience. I remember sitting talking to her, and she told me a story how she remembered he was in the hospital at one point for several weeks, and she walked in and out of a hospital every single day, passing and seeing the same people, and no one addressed her. And she just felt invisible. And so what she did from her experience was she really rallied people together from a philanthropy standpoint and started the Ken Hamilton Caregiver Center, where she used volunteers like herself, people who had been family caregivers that then wanted to come back and kind of volunteer their time to help support new family caregivers who were in the healthcare continuum. And Ken Hamilton's Caregiver Center is in a hospital. So that was the model that opened in the first in the country, and I really replicated that. And when I went and met with Marion and the team there, Jerry was the social worker and Maria Hale, I was inspired by something that I had never seen before. In palliative medicine, I was doing caregiver support groups, I was running a telephone support program, but I never saw a physical space or even thought that could be something. And so with their mentorship, I was really proud to open the Caregiver Center at Peconic Bay in 2018. And since then, I've helped to peer support along with Ken Hamilton Caregiver Center. We're up to the 10th Caregiver Center across New York.
Wow. Awesome. Thank you for sharing that with our audience. And then as you were speaking, I was just thinking about the story that you shared about Ms. Hamilton, felt invisible, and the fact that she was giving care and she wasn't getting any care. So Dawn, that brings me to the point that I'd like you to expound on, and then I can swing back to you, Tara, to talk about caregiver mental health and stressors. Because if anybody that's been a caregiver, it's a huge amount of mental, emotional, and psychological stress. So talk about that from that standpoint, please, Dawn.
Absolutely. And, as has been one of the themes in this conversation, right? There's like so much nuance, in terms of the psychological stress of, caregiver and caregiver burden, right? So, and, I will be completely honest, like I've experienced a lot of this, throughout my journey, everything from, just the sadness of watching someone that you love, like who is chronically ill, who is disabled, who is in pain, who, may have officially been told that, that they are, coming to the end of their life. And so there's that sadness, there's that anticipatory grief, right? That comes along with that, while you are also providing care at the same moment, at the same time, because many caregivers share, this certainly has been my experience, that, in the conditioning around providing care, whether it's as a family caregiver or even as a professional caregiver, but certainly as a family caregiver, we are conditioned to prioritize, the person, who we're caring for, and to prioritize their needs, to prioritize their wellness and their care. And so we often just push our own, feelings and thoughts, to the side and suppress them in many cases. And so, additional psychological stresses, there could be resentment for caregivers who are not receiving support particularly from family, whether chosen, or biological family. The overwhelm, the guilt of, which again, I can tell on myself about that, in terms of the guilt when I go on vacation. There are times where I've gone on vacation, or I've gone out of town, and, my mother had to go to the hospital. My mother wasn't feeling well. Like there are times where I felt guilty about feeling guilty, or even just leaving the house, sometimes if my mother, generally has not been, doing well in a particular period of time. And so, the guilt in itself, can be a huge, impact, mentally, psychologically, emotionally. Um, the feeling of isolation, and feelings of isolation can be physical isolation, right? I have a friend, a former classmate who's a caregiver who is living in a rural community because they returned home to care for their father, right? So they could be the physical, and they don't have any siblings. They're an only child, and both parents were only children, right? So they literally don't have access to family to support them. And because of this, the geographical isolation, there's a lot, that they're bearing. But there also is the social isolation, because many times we feel like either nobody understands, nobody wants to support me, and maybe we've even asked for support and haven't received it. We don't want to complain to people. I know that comes up for me a lot. I don't want people to think that like I'm a broken record. Thank goodness for my therapist, over the years. So when you think about just that small sample that like I've shared, and for many people who like have a compounded experience of that, it is incredibly overwhelming and distressing. We know that there's data out there that tell us that, in that 53 or at least 53 million, population of family caregivers in the United States, there's data that tells us that anywhere from 40 to up to 70% of them in any one given calendar year experience at least a minimum of features of depression and anxiety. So not only, do people experience distress, there are many who, as a result, of caregiver stress and burden and everything that comes with that, like literally are experiencing, you know, diagnosable, forms of depression and anxiety.
Okay, thank you. Tara, would you like to add to that? And then that's something I want you to really expound on.
I've had the privilege to spend, more than the last 10 years with family caregivers. And I think I literally, even my research with family caregivers, I have to say it was an epiphany, was hearing family caregivers explain that you have to give up something to become a caregiver. And in that, regardless of thinking of like anticipatory grief in terms of loss of life or loss of, losing the person you love, there's just loss from the beginning in caregiving in terms of loss of freedom for caregivers, loss of the ability to make decisions without thinking about someone else. Like Dawn said, like that's, really something that I've been so interested in my research because it's come up so many times. Prioritization of others over self. It's, for family caregivers, it's just how they live. And I think when you think about grief, right, if I said to you, Silas, like, oh my goodness, I just lost the person I love the most and I'm really struggling, you would say to me, it would be very normal for you to say to me, you should go talk to somebody. Like you should go, Dawn talked about it, you should go talk to someone, you should go to a bereavement group, but we don't think that same way when someone tells us that their parent just had a serious stroke and they can't live on their own anymore and they're caregiving for them. We say, oh, I'm so sorry. We don't think about how that's going to impact also, though, the person who's caring for them, who loves them so much. And so I think we just need to understand that these things, depression or anxiety, are part of taking on this responsibility. It doesn't mean that there isn't also joy. And I know Dawn and I have had many conversations about this, because to me, being a caregiver is like, it's like an ethic of love. You do it out of something that says, for you, who you are, what was important, what's your family values, what's the values for yourself that you brought up. So there's a positive from that, but that positive and those things like depression and anxiety and stress, those both things can be true at the very same time.
Absolutely.
And I think that's the part that people need to understand about caregiving, because it isn't that, like Dawn said, I feel bad, sometimes even saying I don't want to be a broken record, but you're not a broken record ever. You're just saying the truth, that two things can be true at the very same time. you can love your mother and be so grateful for the time with her and proud to be able to be there to care for her. And you can also feel completely exhausted and sometimes really sad about, the situation she's in and the situation you're in and having to care for her. So I think that's just really important for people to start to open their minds to. When someone tells you someone they love is sick or ill and they're caring for them, you have to really think of what does that person need who's not the identified patient, what does that caregiver need? So it could be as little as just calling them and asking them how they're doing. It could be as small as asking them if, can you drop off dinner? Or I always tell people, don't ask them what you can do, just show up. Because a lot of times I've found family caregivers have told me, no, I don't need anything. And then when I extend without asking, they're always so appreciative because it doesn't give them the opportunity to really say no for small things. I mean, don't insert yourself into someone's home at bedtime. That's not a great thing for a family caregiver. They'll get upset. I will say, think of what things you can do for someone who's really trying to do everything for someone they love. And, we all get breaks from our jobs, but family caregivers don't get breaks. There's no sick day. There's no vacation time. Even when people get a little bit of what we call respite, their brain doesn't shut off from worrying or thinking about their loved one. And I just think, we needed to, as a society, as a community of people that care about people, understand how we can think of family caregivers and understand it's something that we really should all be more open to asking how we can support them.
Okay. And it seems that, based on what you just shared, that answer that you just gave, without really understanding the whole nuance of it, did you just kind of discuss the 4Ms, the medication, the mentation, mobility, what matters most?
I think I must be dreaming about it in my sleep all the time. I work so much with the 4Ms right now. You're right. I probably weave it into every conversation. I don't know if people know that, but yes, the 4Ms, it's Silas, it's a framework that in healthcare, the John H. Hartman Foundation has really done so much research and funding around making this framework accessible to healthcare systems to understand how healthcare systems and care delivery need to think differently. But now I'm really focused on how do we work with family members for them to understand how they can use the 4Ms to help them advocate and know what they need to ask about for their loved one they're caring for who's aging. And it's like you said, it's a framework built around 4 things that are really important for an aging population. It's mobility, medication, mentation, and the 4th M is what matters most. And so this framework for an aging population, what I like to use as the analogy is, I'm a mom, I have 3 kids. When my kids were little, I had to learn from the pediatrician the things I needed to know were important to understand for my small kids growing up to be healthy and what things I need to watch for, right? So it were things like immunizations. It was things like, what were the dangers in my home I had to be concerned about for them to be safe. When we think about an aging population, there's actually clear, specific, evidence-based things that we know is important for not just health systems and healthcare providers to know and really practice in, but also for family caregivers to be empowered with that same information and knowledge that these are things they need to be able to ask the questions and ensure that this framework is being considered in the care for their loved ones across the continuum.
And that really then brings up the next point that I'm going to swing over to Dawn to talk about resources to support caregiver wellness.
Absolutely. And there are, many different, types and, just levels to the types of support. And one thing I will just start off with is that they might not always be labeled as caregiver or caregiver support, right? But I am, starting to see, an emergence, if you will, of, many more types of support that are starting, to be offered specifically for caregivers. Tara has made mention of the caregiver centers in the Northwell system. I have to start there because my world was rocked. I think that was back in November 2023, October, November 2023, where I visited one of the caregiver centers in the Peconic Bay hospital in Riverhead, and I'm glad to hear that they're continuing to expand because I feel like that's a model that almost every, hospital in the world, not just in the United States, needs to offer. I mean, to know that these centers are there. They have like meditation room and resources and snacks, and you can, what are the Chase lounge chairs, like everything that I know that I need when I'm spending, and usually it's overnights with my mom in an ER, waiting for her to be admitted into a hospital, you know. So I can't. And they offer coaching, caregiver coaches, and support, and the way that it's woven throughout the system within the hospital. I took a tour and, got to speak to the nursing staff and like the staff on different floors within the hospital. It literally like is a system. And I feel like I want to start there because, again, I think it's something that we can tee up to collectively because it's a model that we know works. And I, as a caregiver, and also a professional like who supports caregivers in different ways, like I think that's the way to go. From there, um, most counties in the United States, usually through their state, systems, they may be called differently, but like here in Suffolk County, we have the Office of the Aging, right? Um, so in most counties, like throughout the country, whatever, municipal, organization that supports the aging population have different resources for caregivers. And again, they might not have the caregiver label on them. Like for instance, here in Suffolk County, the Office of the Aging, they have very specific um, free access to mental health support for caregivers, support groups, individual support, resources. They also offer support with applications for any, financial benefits or, other entitlements. But they're doing that in partnership or in support of caregivers and not just, the aging people, right? So I would absolutely encourage folks to seek out your counties or even your state, because each state has an area on aging as well, right? But start with your county, or your city if you live in a city and not necessarily a county, to start there. Um, there are also online forums for caregivers. For many years, I have been involved in AARP has a Facebook group for caregivers that has offered tremendous information, support, resources, inspiration, um, even just the community support alone is makes it valuable. But when I say I have learned about resources that not only have benefited me and my family, but that I've shared. So, there are online forums you can search on Reddit. There are forums, there as well. Many of them, you could be anonymous, if folks really want to share, like the truth of their experiences without, any judgment or, hurting anyone's feelings. You can do that. So I certainly would, for people who have access to the internet, encourage folks, to seek, support in that way as well. I've actually like met, other caregivers that like I've known in, some of the forums for years, and it's all just been incredibly rewarding. And then of course, you know, any, of the health systems that, caregivers might access, for the folks that they're taking care of. Sometimes they either may have explicit support for caregivers or they may have additional supports, that caregivers would be eligible for, even again, if it's not titled, caregivers. And then there are a lot of caregivers across the country who just offer community or social space. It might not be labeled a support group, but I have found just in my own, networking and community building among caregivers or other professionals who support them that there are community groups, that either meet in person or online, um, that offer support or, offer social, connection to caregivers. Because, we also, benefit from just the connection. It doesn't always have to be, like a clinical, support group, which, of course has its value, but yeah. So there are, resources out there, that folks can access. And I just look forward to there being more explicitly named and created supports and interventions and, other ways of supporting caregivers.
And Tara, previously when you were giving out some of your information, you mentioned a couple of terms, and I'd like you to elaborate a little bit for some of our audience. Respite and hospice. How do they tie together? How does one support the other, or do they both support each other? And what should viewers and listeners know about respite and hospice?
So I'll start first with hospice because it's very clear. So hospice is a specific type of end-of-life care that is determined by a physician when they believe that due to a diagnosis, a person has 6 months or less of life. They're eligible for hospice services. And hospice generally is in someone's home. So it's usually community-based, where a hospice organization provides like a nurse who visits. They provide medications that are delivered to the home. They provide 24-hour phone number to call if there's a concern. They provide equipment like a hospital bed and the kinds of things you would need to be able to provide care so that a loved one, as they begin to transition, they can be surrounded at home by their loved ones. What I will say, though, is hospice does not provide 24-hour care of your loved one in your home. And having been a palliative medicine social worker and having myself taken care of my Uncle Joe with our family at home because that was his wishes, it is often for family members, it's hard to be grieving, like Dawn said, and also be caregiving at the same time. And that's a very intense type of caregiving. But I will say for families that have the ability to do that and take someone home, it is also, to have been able to do that is an extreme honor, to honor someone's wish that that's what they want for the end of their life. Hospice can also be in an inpatient setting. So you can have end-of-life care, hospice care in a skilled nursing facility. You can have end-of-life hospice care, can go into care settings like assisted livings if it's appropriate for them to receive care there. And you can have hospice care in an inpatient setting. There's, on Long Island, we have a couple of hospice freestanding centers. In Northwell, we have the Hospice Inn is in Melville, but there's other organizations like the Visiting Nurse Service that has a hospice inn in Northport, and there's a hospice through Catholic Health Services that are on Long Island, and there's East End Hospice has a hospice inn that's out is in West Hampton. So across Long Island, there are a few inpatient hospices, but you have to meet criteria to be eligible to have inpatient hospice in a hospice freestanding center. And so I think a lot of times it's important that at the time where you are, your loved one is nearing the end and is eligible for hospice, that's really not the time when you want to talk to people about what matters most to them for their end of their life. So I love that you brought it up. What is hospice? I think that, it's always good when someone's diagnosed with serious illness just to start and frequently be asking, what's most important to you today? What's most important to you right now? Because those things shift as an illness progresses, but hospice is really care that everyone is eligible to. It's covered under Medicare, it's covered under Medicaid and all insurance, and it's for people who the physician believes their diagnosis that they have 6 months or less. In terms of the second thing you were asking me, I apologize. You have to remind me what's the second one.
Respite.
So respite care, oh my goodness, I so want more respite care. So respite for family caregivers is when your loved one, you are the primary caregiver and you don't ever get a break. And so there's some west of, I'm out east, so west in Nassau County, there's some opportunities to have respite where you can actually bring someone to like a skilled nursing facility and pay and arrange for them to stay there for a few days, and so that you can either get away, or sometimes a caregiver themselves has to have a medical test or a surgery where they need a place for their loved one to stay. The further east you go, the less options there are. What more often looks for respite is in terms of things like stipends or monies to help family caregivers offset the cost of hiring someone to come in your home and give you a break with your family member in order to let you do some of the necessities of life, like getting to your own medical appointments or having just some social time outside of your caregiving role to connect with people, like Dawn said, which is so vitally important for well-being and mental health. And so that's respite. There's a lot of different organizations that offer some monies towards respite. So it would be really important. And I would say anyone who's listening to this, I'll give Silas the information for the caregiver centers across Long Island. They're free through Northwell Health in terms of the social workers in the centers can provide resources or information on what the respite options are in someone's geography, because they do vary very greatly. But I'd say today, mostly respite is in the form of a stipend or money or a grant to help offset the cost, because hiring care in your home is very expensive. And there is no coverage for care in your home under Medicare. Medicare, which is the insurance for aging population, right? You work, you pay into Social Security, and when you turn 65, or for me, I think it's 70, I don't know, keeps changing on us, Dawn, you get Medicare. That's your health insurance. But Medicare pays zero for help in the home when you can't care for yourself. So it covers your medical in terms of your doctors and offsets your pharmaceutical costs. And if you fell and needed to go to short-term rehab, it covers that, but it doesn't pay for any long-term care or any paid care in your home at all.
And Dawn, Tara mentioned about when she was just describing the whole concept of respite. She mentioned that people shouldn't wait until somebody's been given that. Not respite, I'm sorry. When she said hospice, they shouldn't wait until somebody gets a diagnosis to start talking about that. So what about people? What do people need to know about end of life terms and issues like advanced directives and DNR and durable power of attorneys? Because a lot of that comes up at the end, and then there's a lot of confusion. So talk a little bit about that, if you would, please.
Absolutely. And I'll start that off by saying, just we collectively as a society, as a global society, are not comfortable thinking about, let alone talking about death at any point, right? At any point in life. And as much as I understand it, I also know that, yes, if we are not able to have these conversations, if we are not able to really begin to think about what we might want, and it's not even just solely an aging, issue. Many people, unfortunately, get into accidents, or they're just unforeseen circumstances that make it necessary, for folks to be able to access, like, your wishes, or folks be able to access your paperwork, or for folks to be able to make informed decisions on your behalf that align with what you might want, And so it is best to not wait until something happens, because you might not be able to get some of those things in place in a timely manner, especially if someone, is critical or terminal, right? So it's important for everyone to know, like, for real, do I want to be resuscitated? What are those decisions that I would like to be made for my healthcare, right? That a healthcare proxy could make on one's behalf, right? That, like you mentioned, durable power of attorney. I have a family member, who's working to get that as, established, now, literally as we speak, right? A durable power of attorney allows the designated person or persons to make legal decisions, not just healthcare, but like to make legal decisions or to access legal documents or anything of that nature that could inform one's care, if they don't have the ability to make those decisions. And so, you know, it's critical to be able to do that if we, like, I know that I don't want to be resuscitated in particular, situations, right? I also know how I would want my body to be taken care of after, hopefully it's not going to be for a while, but when I do choose to leave this earth, I know, and my family has known for years, and you can also have that put in writing, right? Because unfortunately, whether we only know from TV and movies and drama and soap operas, a lot of people who are grieving make decisions based on what they want and might not align with what their loved one who has passed on may have wanted, right? And so it's important for us to be able to think about, what we might want and need before we can even talk about it, but we need to be able to talk about it. And then we also need to be able to access the resources so that we know, what we might want and need to put in place. And certainly there are everyone from social workers, case managers. I know there are some libraries that offer free support to put these things in place, elder care attorneys. Like there are various professionals, organizations, resources, that can support folks with learning about, what is needed, and, even supporting people, with having all of that put in place. But it is absolutely necessary. I'm just in this moment thinking of a former client of mine who was in an accident, like in perfect health, before that, but who was in an accident, literally like stepped off the curb and was hit by a vehicle. And just the turmoil that they and their family members experienced, family chaos and tension erupted throughout this process. And, the good news is my client eventually healed. And I remember a long time after the accident, after they had healed, just having a conversation with them, about like, they were like, I've always known in my head what I wanted or what I didn't want, but I never, took the steps to actually, put it in, in writing or have, any legal documents or designations, drawn up. And so it saves a lot of headaches. It can save a lot of drama. And I think what's most important is it can just ensure that in whatever situation we find ourselves, up to and including, our death, that our wishes, are honored, especially if they are like, included in legal documents. So yeah.
So important.
Anything you like to add to that? From
No,
your standpoint?
Dawn did beautiful in that. It's,
Okay.
I
Right.
just think it's important that we just keep talking about these things because the worst thing the thing I hate the most is that I meet a family caregiver at the point where they're having to make every decision without being informed from the person they love the most about what they would have wanted. It's just everyone just really struggles with that burden of, am I doing the right thing? And like Dawn said, you're already having all your own complex feelings of, anticipatory grief and just shock and being overwhelmed, and then having that all on top of it. So talk about it. It may feel hard at first, but Dr. Pat Bamba, who I've had the privilege to get to work with her for a long time, she helped to kind of create and lead the New York State MOLST, so for the Department of Health, and she always said at Thanksgiving she would sit around and say to everyone in her family, okay, everyone's invited to my house, but everyone's going to sit around and we're all going to talk about, what you want if you were to die before I pass out the apple pie. And so I always think of her, and when I think about talking with my family, I kind of feel like I'm a little bit of Dr. Bamba in me.
So, tell viewers in the audience the acronym MOLST.
Sure. The MOLS is medical orders for life-sustaining treatment. It is the New York State form. It is actually medical orders. So like the same as like your doctor writing a prescription. This form is through Department of Health. It's a bright pink form. It's made pink because it's the only form and advance directive in New York State that EMS can honor. So like if you went into an attorney and you got your advance directives and it said you don't want to be resuscitated, that can't be followed by EMS. The only form and documentation that EMS, when they respond to an emergency to your home or can follow, is in the MOLS. And so it's really an important document. It's a very person-centered document. It's a document that anybody diagnosed with a serious or advancing condition should really be asking their physician about having a MOLS conversation so that you can change your decisions on a MOLS. It's not like one and done. It's not, you're not married to it. It can change. And you should be having, frequent conversations when you do a MOLS. I'd say, I think it's recommended every 6 months that you talk with your care provider to ensure that you haven't changed your mind on any of those decisions. And if you did, you're able to change them to whatever you want at that time. But the MOLS takes away the question of even your healthcare proxy deciding. The MOLS is your decisions made. And so then that just means the care team and your healthcare providers just, your medical orders are already decided by you what you would want.
Okay. So if I'm understanding correctly, then the MOLS would override or supersede both the advance directive and the healthcare proxy, correct?
Mm-hmm. If it's done correctly,
Okay.
yes. So
I can attest to that because we have one from my mom. And so we generally have a conversation annually, but as Tara said, like you can update it as needed. So like there have been periods where, my mom has been chronically ill for, over the course of several months, and then things might actually even out. And so within that window of those few months, we have had that updated, but then we might be able to go another year, before we update it. So yeah.
Okay. Next thing is we get ready to come to the end is a woman, Dr. Elizabeth Kubler-Ross. She came up with an acronym called DABDA. They talk about this as the 5 stages of dying, and it's the denial, anger, bargaining, depression, and acceptance. So have either one of you had any experience like trying to help somebody navigate that? It's something that was always very interesting to me, that somebody came up with a concept called the 5 stages of dying, came up with that acronym called DABDA, and they have 5 different stages. So anybody have any insight on that? Just throwing that out there.
I love Kubler-Ross, so nothing against, but what I will say is we've really seen a shift in the stages of grief. And David Kessler, a lot of the more current mindset in terms of clinical work for grief is not that there is necessarily stages that you go through, that caregiving is you're often it's more of a fluid process where you're going through many of those stages and over back and forth. It's not kind of like a chronological progression that originally Dr. Kubler-Ross introduced to us. But I think this, additional added framework on top of there is really understanding that grief doesn't have one way of being experienced by humans, and that those stages that she identified, that those are most commonly different feelings that people having grief go through, but they go through them in different orders, and sometimes they go back and forth. And having had the privilege of running bereavement groups and support groups, what I will say is, and I so much, it was really the key as why I started family caregiver support groups, was that there's something about when you're grieving, being in community with other people that are experiencing grief also. Even though their individual grief journeys can be so uniquely and distinctly different, there's just a shared understanding of each other in what how deeply personal that pain can be. And I really mirror that to what I've seen in support groups with family caregivers, that it transcends even sometimes words of needing to understand. That when someone shares something in a support group that is so deeply painful and personal, just watching the other faces in the group with just completely connection to understanding what that means, is really powerful. So I love Dr. Kubler-Ross so much, but I do also love Dr. Kessler and kind of where we think now in terms of clinical work in grief, because we all are going to lose people. And as much as there's advancements in healthcare, we can help people live a lot longer. We can't cure CHF. We can't cure MS. We can't cure COPD, Alzheimer's disease, ALS. We can't cure metastatic advanced cancer. So, I kind of would be afraid if we can cure everything and we live forever. That wouldn't be good. But I definitely think, thinking about life and the cycle of life, that arc, I agree with Dawn. People don't want to talk about it, but I feel so much so that when you work with people who are experiencing grief, there's so much meaning in terms of the love in a relationship, that I really would love to see a lot of that meaning making work happen really at that other end of the arc, at the end of life for people, where we're engaging with people in an aging population and really celebrating all the meaning making that they've done in their lives, and kind of finding a joyous way to think about that, even through illness and hard things, because there's a lot of wisdom and lessons learned there.
Absolutely, absolutely. And one of the things, as we get ready to wrap up, is to talk about, both of you talk about what are good techniques to use to help someone who maybe has been given that end of life diagnosis, and they know that they've been given 6 months or 3 months to live. What are some ways and techniques to work with that person in those last stages of life? So I'm going to just open that up to both of you, and either one of you can answer first.
Dawn, you want to go first?
Are we talking professionally and or personally?
Both, if you could.
Why don't you talk personally?
Okay, I think, well, personally, I think it's just most important to be present and to center and prioritize that other person, right? And I'm not saying that, as the person who is supporting someone who has, say, been given, a diagnosis, for us to, dismiss our own feelings, but to be present and to listen, to not, default, to unsolicited advice or what we think might be helpful, and maybe they're wrong, and miracles do happen, and yes, they do, right? But if someone has just been told, most likely by a medical professional, and most likely by more than one, most likely by a team, that based on, whatever, health challenges, issue, diagnoses, that, it's looking like their time is about to come, that you just want to be present, that you want to offer love, and even just being silent. Like, I think some of the most powerful presence and love doesn't necessarily have to be said, and to really just connect with where that person is at, and to engage in that dance, and ask them, how can I be of support? How can I, what would work best for you in this moment, in terms of me loving you and supporting you? And be okay with what they tell you. They may tell you, I need to be alone, go, they may not even be able to answer, right? And so I think it's important for us to be aware of how, us being a witness to something like that is going to impact us, so that we can be caring for ourselves while also being present with this person who just received this news. And even in asking, how can I support you? But don't do it in a way or don't overdo it so that it does put a burden on that person. But just also communicate that, like, I am here and, to offer the best support, for you in this moment. And that's not dictated by what I might want or what we see on TV, that it really is about, just being present with this person, this human, this spirit.
I would just say on the professional side, I'm gonna just say what everything Dawn said is the same.
Right.
I think when it comes down to it, we're all just human beings who we all just want to feel connected and feel love and feel seen and heard by other people. And, when you're getting the news of something that is a really big thing to think about, the end of your life, people think very differently. Some people think in terms of, what's the physical pain or what am I going to experience is the first thing in their mind. Other people think about the pain of their family members, like how are they going to handle this? Other people think about existential pain, like, who am I? Or sometimes people think about, fractured relationships in their life, that maybe things that maybe they don't have in a place of resolution that they would want. So I think just showing up, like Dawn said, and just being authentically, like she said, not kind of trying to overdo it, but really be authentically present to just say, I'm here, whether you want to talk or you don't, or there's nothing, sometimes people will say things when you're not asking them anything, when you're just giving them space.
Right.
Being present, like she said.
And I think it's important to be prepared for however they might receive that news. They might be in denial. They might be like, they don't know what they're talking about. They may be angry. They may curse you out, and you're not even the one that gave them the news. There's just so many possibilities. And I think, like we have to, if we are going to show up, that we have to be prepared for what that's going to look like, especially initially. And what their process is going to be from there.
And I would say for professionals, just like Dawn said, for loved ones, you have to be very self-reflective and self-aware in terms of how you have to take care of yourself to be able to be in that space with people. Because it's a privilege to be in that space with people. But like Dawn said for herself, I'm very grateful for my therapist, because you can't hold that space with a lot of people without really need to process through that yourself. And so making sure if you're professionally working in that area with people, or if it's in your personal life that you're experiencing, that you really are self-reflective and have self-awareness that we need care while we're going through that with people too. Just, to be able to really be okay and have wellness in the terms of a lot of often what is such a sacred space, I think.
Okay, and on that note, one of the things that I like to do at the end of each podcast segment is, as we wrap up, and I want to first and foremost thank my two esteemed guests, Dr. Tara Anglim and Ms. Dawn Shedrick, both LCSWs. I want to thank you both for this wealth of knowledge that you shared with our listening and viewing audience. And I'd like for all my guests to always leave our audience with something positive that they can take with them, and keeping in with the theme of this podcast segment, how can people show that aging matters in a positive way to those who are going through the aging process? So anything that you'd like to share to wrap this up, open up the floor, and each of you can share some.
I just always think that aging is, for me, it's a privilege. Not everyone gets to age. So for me, it's a mindset. When I've had many people over the course of my life say to me, even very young, they don't celebrate birthdays after a certain time. I celebrate all those milestones, and I try to celebrate those milestones for the people I care about and love too, because aging is a gift if we're lucky enough to have that. And that's whether you're aging with illness or not, because you have gained so much wisdom as you're aging, and there's always opportunities to share the gifts and the wisdom that you have. You just have to be given the opportunity to be able to do that. And so I'm just really hopeful that we're talking so much about this in so many spaces that we're going to really be able to see that for our aging population, that they really hold so much for us if we just can tap into it.
Thank you for that.
I love that. And I'll just say that I believe that the extent to which that we, no matter where we, meaning the supporters, the professionals, whoever we are, who are supporting folks who are aging, the extent to which we are willing to really be with and think about like what that means to us and for us, that allows us the awareness, the skills, the opportunities, the gifts, right? And hopefully humility to be of best support, to folks who are, aging, again, whether it is, with or without illness. Because I think there can't be that disconnect. For me, I don't believe that it's just about, okay, I'm just going to provide this support. It has nothing to do with me. I'm 30 years old. I'm good. That it really is about what does this mean to me, and how is this showing up for me so that I can be of best authentic support to people who are, who are in advanced age, which I agree is a blessing.
And on that note, again, I'm going to thank you both for coming on and giving our viewers and listeners a wealth of knowledge. Again, to all our viewers and listeners, you were listening to the Kelsunn-on-the-Air Social Work Podcast. We had an engaging conversation with two subject matter experts, Dr. Tara Anglim and Ms. Dawn Shedrick. Dr. Anglim is the Associate Executive Director, Culture and Experience for Peconic Bay Medical Center, Northwell Health here in Long Island, New York. Thank you so much for joining the show, Dr. Anglim, and Ms. Dawn Shedrick, licensed clinical social worker, consultant, educator, and trainer. She founded Gentex Training and Consulting as a professional development firm for health and human service professionals. And she's been her mother's primary caregiver since 1996. I want to thank you both for joining the show. And you tell all our listeners, please make sure to listen, subscribe, download, comment, and share. Thank you so much. And thank you to my two esteemed guests.
Thank you, Silas.
Thank you.
Once again, this is Silas, your e-journalism social work advocate, producer, and host of the show. You've been listening to the award-winning Kelsunn-on-the-Air Social Work Podcast. This and all other episodes are available on our Apple, Spotify, Amazon Music, Audible, and iHeart audio podcast platforms, among others. The podcast is also available on our Spotify and YouTube video podcast platforms. Go to any search engine and type in Kelsunn-on-the-Air in the search window to hear this show in its entirety. Please make sure to click subscribe to support our podcast. And don't forget to like, comment, download, and share. To reach us for more information, email us at info@kelsunn.org. That's info@kelsunn.org. Or to suggest future topics, log into www.kelsunn.org. That's www.kelsunn.org and fill out the Share a Topic form on our homepage. Thank you for tuning in. This has been a Kelsunn Communications production.